we have prepared slides to discuss this with you. Define basic terms associated with infodemics. You've heard some of these already. Describe common approaches used to manipulate people with misinformation and how to address these. And we will also learn together about strategies and tools to rebut, to pre-bunk and debunk health misinformation. And we will explain all of these terms to you. So when it comes to definitions, we have actually discussed these concepts related to how people search for information, how they access it, and how they experience it during an emergency. We've discussed this now through several lectures. You've heard earlier from Richard about unsettled science. So many times, especially during an emergency, there's no definitive answers yet or scientific updates to different questions that people may have and that are seeking answers to. Message penetration is another term. It's an ability of a person to receive and understand information as it was intended. We discussed about information overload. So when people are being overwhelmed with information, and this can cause confusion or difficulty to act on health guidance. Rumors is a term that has been around for a long time in public health. So this is information inaccurate or accurate that is circulated within a network of people. Misinformation is information that is inaccurate, and what makes this information different is that this is actually misinformation specifically designed to achieve a particular agenda. And we've also been discussing the importance of information voids. So this is a situation where people are actively seeking information, but they cannot find credible sources. And this means that there's a much higher chance that their attention would be taken by other lower quality sources of information or even misinformation. So down on the bottom, how WHO defines infodemic. It's an overabundance of information during an acute health event, such as an outbreak or vaccine safety crisis, I would say. So what types of harm can the infodemic contribute to? You see here a list. It really can manifest itself both in physical worlds. It can have social consequences, economic, political, psychological. These are some that we've already discussed, but needless to say, this is not an exhaustive list. And you can really imagine, because it's so complex and it can impact so many different parts of our lives. It also means that it's extremely pervasive and it's very difficult to manage. Liz, did you have any other comments on this slide?
No, I mean, just to say from a scientific perspective, we're still trying to understand there's, I think, a lot of literature saying that there probably is a relationship between these consequences and the infodemic and misinformation specifically, but how they're related and the burden of this are still, I think, those are questions for science that we're still trying to figure out. But generally speaking, good communication, good programmatic and emergency response, thoughtful community engagement, thoughtful infodemic management, all of these things can help address and mitigate some of these. That's the goal that we're trying to achieve here. And so just to say, it goes way beyond the decision of whether or not you want to get vaccinated. When you talk to vaccine people, and I'm a vaccine person, we tend to be really interested in one behavioral outcome, which is, did the person get vaccinated or not? But as we can see, there's many other types of harm that can come beyond just the decision to follow one particular piece of health guidance that goes just beyond that one particular behavior. These are all behaviors. And so understanding how the infodemic links to people's intent and behavior, especially offline, because these things happen offline, is going to be really paramount in the future. But we have a few things you can do now when it comes to addressing mis and disinformation. We'll talk about that in this lecture.
Yeah. Thinking back to the public health and social measures lecture, remember the effective management of epidemic risk in the community. depends a lot on adherence to many different types of guidance and different public health and social measures that are implemented in packages, whether it's vaccine, whether it's whether it's immunization, or whether it's physical distancing, washing hands, etc. And all of those are also linked to better effective communication, community engagement, etc. Liz, would you explain this continuum of information being a part of the infodemic?
Yes. So the infodemic is made up of more than just misinformation. And just want to point out here that this can go from questions to concerns, information voids, misinformation, and disinformation. All of these make up the infodemic, and the growth of narratives and if sustained, increasing potential for harm as you kind of go from the left-hand side to the right-hand side. If you don't address questions and concerns and people are hitting information voids, guess what fills them? And so it's really important to think about all of these aspects, not just the mis and disinformation. And the reason for that is that although it probably has outsized impact compared to the total volume that mis and disinformation make up of the information ecosystem, we're ignoring a lot if we're just paying attention to the misinformation. And you'll hear this again and again from us. It's not just about misinformation. It's much more complex than that. To give you an example, in the United States, the sum total of vaccine conversations about COVID-19, about 3 to 5% are actually misinformation, 3 to 5%. So I think Tina was at a different panel earlier today where there was a very similar, very, very low percentage of content that's related to actual misinformation versus other types of narratives. So it's just important to remember that when we're talking about misinformation, we're talking about a very, very small segment of the sum total the volume of conversation. So let's talk about what that means practically speaking. So if we advance to the next one, everything on the left here are things that health systems have much more influence over, right? Addressing people's questions and their concerns and filling information voids. And you can do that through social listening to understand what all those questions, concerns, and voids are, and then doing something about it. However, you have less influence on the right-hand side here. You have some influence, but not a whole lot, especially as it comes to disinformation. Usually disinformation is not in the remit of a health department or a ministry of health or a health agency. Usually it's other parts of government that are responsible for addressing that. And we might have some influence over misinformation, but I don't think anybody can claim that they are really on top of it for all health misinformation tracking and response within health systems. It's just a beast that's far more complex, and misinformation has a way of burrowing its way into networks that we can't access and that we can't see. And that's probably where it's causing the most harm. So just to say that we're really looking at a small piece of the big pie for this presentation, which comes back to all the things we've been telling you ad nauseum for weeks now, which is ways you can address these questions, concerns, and information voids include listening to and analyzing conversations and narratives. That's social listening. That's integrated analysis. That's infodemic management. Sharing accurate, clear, and easy to find information that addresses common questions. This is really basic, but you'd be surprised how hard this is, because what people were worried about a month ago is not what they're worried about today, which means you constantly have to serve up fresh content based on these insights. And they also have to remember not everyone's online. So how do you reach people offline where misinformation can also cause damage? And then finally, use trusted messengers to boost the credibility and the likelihood of being seen and being believed over misinformation. This is really important. It's not even what you say, but it's how you say it and who says it that has real focus and importance here.
Right. So what are the common types of mis and disinformation, and why do people share them? Here, we're actually linking to the U.S. Surgeon General's Health Misinformation Toolkit. It's a really, really nice document that I recommend that you take a look. But here's the common types. Memes. You've seen them. We use them also in Kronos to communicate. They're colorful images and graphics. They were created as a joke, but people then started resharing thinking that they were true. We could also have sharing of cherry-picked statistics. Really, people can choose, for example, the number that supports what they want to communicate, and then they use that and repeat it and misrepresent it. Misinformation can also be in the form of websites that look very professional. Nowadays, this is not really hard to basically you have services that you can set up professional looking websites quite a lot. And when you put sensational headlines on a website like that, people that don't pay attention can easily believe the information that it serves. You can also communicate misinformation by graphs and diagrams that look official. Then you also have quotations where they were taken a bit out of context, or parts of the quotations were deleted and the meaning of the quote was changed, attributed to a real person. Very most common types of misinformation actually on the internet are old images or old content that was recirculated, as they were actually very recent. And the last common type is videos that have been edited to change their meaning. But of course, misinformation, the reason why it sticks in a person's mind when we see it, it's because it's not about factual communication, it's about emotion and the emotion that evokes in people. Liz, do you want to explain why people share health misinformation?
Yes, and so these are just archetypes. So this is not going to be exhaustive and represents absolutely everybody that shares misinformation. The vast majority of people that share misinformation do it because they don't realize that it's misinformation. They think it's important information that they want to share with their family and their friends to protect themselves and their family members and their loved ones. Like we have to remember that the motivations for sharing misinformation, most of them are not because someone truly has an agenda. However, this slide kind of gives you an example of the different types of motivations that there are out there. So you have the disinformer here on the left, which is kind of more on the creator end versus the sharers end on the right-hand side. And the disinformer is very much creating deliberately harmful misinformation. You have the hoaxer that creates hoaxes to fool people, maybe to make some money. The enthusiast that post misinformation frequently to support a person or cause. The casual sharer, which is someone scrolling, doom scrolling, and then just sharing information without really paying attention to what they're sharing. And on the flip side, you have the mischief maker, which can be someone who just wants to have fun and really enjoys causing emotional tumult, and the people that think that likes, clicks, and shares and engagements online are something that they seek and that they want, and that validates them. And then you have the believer, someone who's deeply connected, who really has part of their identity associated with this particular narrative theme or issue that this misinformation that's being shared is all about. And they tend to be part of a community, and that misinformation circulates in that community, and they tend to share it out from that community. Then you have the overshare, which I think all of us have family members that do this or friends that do this, where it's the person that has no filter. They just share everything that comes across their screen. And so these are just the common archetypes that you can come across. So if you've adequately addressed questions, concerns, and information voids, and you don't know how to address the mis and disinformation, here's some strategies you can try.
Shall I? Okay. So this is an interesting slide. It's a figure from one study, but actually there's several that have been published by the same group of authors in the literature that were looking actually at. So in the pink, you see the amount of misinformation that was identified in different regions in the world on particular topics. And in the green inside is fact check. So the share of that misinformation that was actually checked and debunked. So the authors basically did a study, a series of studies where they found that high exposures to misinformation, so even if you have a lot of misinformation circulating around you in the information ecosystem, this actually doesn't mean that people will believe in the misinformation. So which means that we need to, this basically means that we need to be really much more thoughtful in which claims, which pieces of misinformation, which narratives we should fact check or not, because then we shouldn't be blanket fact checking absolutely every piece of misinformation that comes our way, but literally look at the potential impact, public health harm, for example. The second thing that the authors found was that belief in false information seems to be correlated with vaccine hesitancy. And that isn't surprising when you think about all of the other behavioral social drivers that that were being discussed and the information ecosystem related factors that we've been talking about. This basically means that we really need to be much more proactive. We need to take actions before people come across that piece of misinformation. Once it sticks in the people's heads, it's much harder to act on it and much harder to counter. And the third piece that the authors found was that just detecting the false information in news is not enough. So again, really being preemptive about questions, concerns, and serving relevant health information, relevant information to people in communities. That's actually, so before the rumors actually can start, that's really the key to addressing. Liz, would you like to talk about all
Yeah.
of the things about effective communication?
I mean, so Richard kind of talked about this from a circ perspective earlier, but audiences will judge the credibility of a message by the message, the messenger, the format, the frequency, and the medium. So it's not just about what you say, but how you say it, where you say it, when you say it, and who you say it to. And remember that people are dealing with a lot of information coming at them. It's not likely that they're going to remember the one thing you said to them or the one piece of information you shared with them. What people remember from a message is usually the gist, which is what is the thing you remember an hour later or a day later from the headline. And the gist in effective communication literally refers to mental representations capturing the bottom line meaning of information or experience. So the gist of a message is that mental representation, that mental image you think about when you walk away, and versus the bottom line meaning, which is the gist in a message. Like, what's the bottom line here? What does this actually mean? And so here's an example of good idea versus bad idea for types of headlines. You can tell me which one is more problematic. So offering a corrective bottom line. In this one, it's COVID-19 vaccines are safer than the risk of COVID-19 infection for people of all ages. Now, if you think about that and look out off the computer screen, what is it that you remember from that headline? Okay, something about COVID-19 vaccines are safer than getting COVID, so should probably get vaccinated, something like that, right? Now, if you look at the headline from Reuters, what's the problem with this headline? Partly false claim. Flu vaccine contains toxic levels of formaldehyde, mercury derivative preservatives. What's wrong with that? You are literally putting thoughts in people's heads about what the issue could be, and that's what people remember is half the sentence. Something about flu vaccine and mercury. And because it doesn't actually say it's a false claim entirely, it just says it's partly false. Well, which part is false and which part is true? I don't know, reading the headline. So do you see why it's really important to consider headlines and how headlines are written, and how, like, when you think about the media perspective, if your job is dependent on clicks and shares and likes and engagements because you work for a digital platform, you can imagine that the second headline might be something that might trigger more clicks, likes, and shares than the first one. And so there also are reasons and motivations for why headlines are written the way they are, but the bottom line is that how people interpret them can also impact their perceptions and their attitudes about any health topic, but particularly vaccines, which was concerning. So there's many ways to think about this, but you need to consider what is the gist, what is the underlying message, the underlying fear or concern that is the reason why this message is so effective or maybe ineffective, right? So hopefully that makes a little bit more sense. There's many more examples I can cite, but this one, I think the headlines, I think, speak for themselves. I don't know if you have anything else to add, Tina.
No, I think this we'll get to. I mean, in the end, what matters is that when we're doing rebuttals, and I think we have a slide later on, we really need to identify and understand what is actually the meaning that is capturing people's attention. Why is that particular statement, or what is behind their question or concern? And therefore communicating that we need to respond to it with at the same level. It's the same as with the headlines. So actually on the left, this headline was written by fact checkers, and they're definitely interested in debunking false claims. So they investigated the false claim, and they've issued what they call here a verdict. So they're communicating, and they would like to correct the record online, and that's really important. So there's a skill to doing this, which means that partnering with fact checkers is actually really useful. when you're trying to do this type of work. Now, what you saw here was an example of debunking. This is basically correcting information, correcting misinformation that is already circulating. Here's a very simple flow chart. So when health misinformation is already circulating, on the left-hand side, if it's yes, well, then does it have traction, or when it has traction to have a potentially high public health impact? And the narrative is fairly fixed, meaning that it's not changing. Well, then you debunk often and properly, and with the example you saw earlier, and then we'll show a couple of more. If, for example, the narrative is flexible, meaning that it's still changing, you basically need to create a set of talking points, but do not start debunking yet. So provide accurate information, but do not debunk yet. So you basically are framing. This is also what Richard was saying earlier when he was when we were discussing circ. On the other hand, if you look still on the left-hand side, if the narratives that you detected don't have yet a potential for high public health impact. And remember, in social listening, we were discussing the risk matrix, scalar judgment matrix, to help you decide which narratives are have potential of high public health harm. So if this narrative isn't falling into the high risk category, then you continue monitoring. You do not debunk, so not to actually promote the topic even further, but be prepared. And on the other hand side, when health misinformation is not circulating yet, but there are topics that you can anticipate that may arise, you prebunk and inoculate. Liz, do you want to describe the concept of social inoculation?
If you play the get bad news game, you actually have done social inoculation, because you actually learned how the skills how to identify and address misinformation. So it's almost like a broadly neutralizing vaccine, meaning like you get for your flu vaccine, like it's supposed to be good against multiple flu strains, right? So so the point is that inoculation is this idea that you're pre-bunking not just one particular piece of misinformation, but you're really unpacking and unmasking for people. These are all the different techniques that people might try to take advantage of you, or how misinformation manipulates you. And you can then use that to basically build mental resilience against all kinds of misinformation, and not just trying to debunk, which is just chasing one piece of misinformation to correct the record on one thing, as opposed to kind of giving people broad spectrum protection against misinformation they will encounter in the future. Which brings us to the truth sandwich. This comes from the UNICEF Field Guide on Addressing Misinformation. Highly recommend it if you have not read it. And it works like this. Fact. You lead with a fact, make it clear, relevant, memorable. You issue a warning. Misinformation is coming. This is the tactic that's used. You present the fallacy, that you talk about what is the issue and why is it wrong. And then you provide the other half of the sandwich, which is another fact. So sandwich with facts on both ends. So example, mRNA vaccines are safe and effective, and have been tested as safe and effective and approved by regulatory authorities, including WHO, to be added to the arsenal of COVID-19 vaccines in many, many countries. However, there's a lot of misinformation about the safety of mRNA vaccines. For example, people have heard that it might change your DNA. This is not true. And that's because mRNA vaccines cannot change your DNA. Like, it is physically impossible to do so. And the reason why we're using mRNA in vaccines is that it's based on several decades worth of research that they were able to put into overdrive once the COVID-19 pandemic hit, and we're able to very quickly develop this next generation vaccine. And they've been very highly effective. And so just remember that you should be getting your science from credible authoritative sources like your local regulatory authority, or your public health institute, or your Ministry of Health. And again, remember that mRNA vaccines are highly effective, and they're safe along many other vaccines. And if you've not yet gotten vaccinated, now's a good time to get vaccinated. So that is a truth sandwich, and it's even smoother if you've had more coffee than I have had. And so this helps with practice, but this is how you want to frame a debunk or a correction as much as you can. And you want to tailor the fact, the warning, the fallacy, and the fact based on who you're talking to. And sometimes remember who
And the
you are.
gist. Yeah.
The gist, right? It's also like who you are might not be the best. You might not be the best person to offer the truth sandwich. So, for example, if someone has a religiously based concern about the purity of the ingredients of the vaccine, if you work for Ministry of Health, you might not be the best person to answer that person's question when they really are asking, I have a spiritual concern about this vaccine. And at that point you say, well, maybe you should talk to your religious leader, or here is the latest paper that was come out from a leading faith council in your country about the safety and the purity and the benefits of getting vaccinated and the recommendation to get vaccinated. So think about the messenger also playing a pretty critical role about whether or not your debunk will be successful.
Yep. But this really is an example of a technique that works. The reason why you start and end with the fact is because people will remember the start and the end of the conversation, and not so much the middle. This is just how a human brain works. And you heard basically Liz really play to the gist, to what is the underlying concern that the person has. So let's skip over to the examples from the Africa Infodemic Response Alliance. They issue debunks a lot, often. This is Viral Facts Africa, the campaign that runs by or under the umbrella of Africa Infodemic Response Alliance and all the partners with it. And you see here both on the English and the French examples of debunks. So false information about COVID-19. Vaccines has persisted online despite mounting evidence showing that vaccines are safe. We also prepared for your reference, and this is something feel free to investigate yourselves, the Vaccine Demand Observatory. It's a UNICEF project that tracks misinformation in countries and also supports social listening. So please check this project out. I mentioned IRA. It's more than just the campaigns you heard from the colleagues in the lecture on message testing, but they do a lot of other work. And if you do work, and if you're interested in pandemic management in the African region, get in touch with them on their website. Let's really quickly
You have 5
finalize with
seconds
this
and the
slide.
room is closing.
I saw.
Okay.
So Liz, here's a challenge, 30 seconds to you.
Okay, so 30 seconds. If you're on the mountain bike, just do the basics, social listening, ensure basic content has been developed, and introduce a basic editorial style. For the 4x4 for middle of the road, equip health workers. Again, that's where you leverage motivational interviewing and equip them with information they need to address misinformation, address new concerns because they're constantly coming up, and create fresh content. Work with fact-checking networks and build content online that the fact-checking networks can point to when they are debunking. If you have a lot of resources, develop content moderation strategies for all your social media channels to determine when to rebut, prebunk, or debunk misinformation. Equip health experts with media and social media skills to address misinformation both on TV and online, and work with digital natives who are also health workers to encourage them to use their voices online to address misinformation. And with that, everybody should go back to the main room. Thanks for coming.